Hey everybody, this is Tom Salemi. Welcome to Device Talks Weekly. I'm here with our Device Talks Managing Editor Kayleen Brown. Kayleen.
Hey.
Hey. So it's Halloween week. We're recording this on Wednesday, but Halloween is Friday. What's the costume deal? I asked Chris Newmarker about this a little later in the podcast. What's going on with your youngin'?
So Jensen has decided for the last 2 months, and he's been very consistent, that he is going to be a dinosaur this year. Yes, the full head, the claws, the roar. He's going all out. So I'm going to be Dr. Ellie Staller from Jurassic Park 1, and Jeff is going to be Dr. Grant. He's got the hat, he's got the kerchief. I have the famous salmon button-up shirt. So we are going to go full original Jurassic Park, and looking forward to that very much.
Wow, I'm not surprised that you are a full family dress-up crowd.
Yes.
That was never in my bag, but that's fantastic. And is this an inflatable outfit, or is this like a cut for your boy? Is this one of those puffy inflatable things, or an actual?
It is a suit, like one of those full, sort of like has the hat and the gloves and everything.
Okay.
It is Portland, so it's almost guaranteed that it will be raining. I love the inflatables, but it will not stand up against rain and wind. So we went with the like cozy extra layer. So underneath, he'll be wearing very, very warm, furry pajamas. We have it all. I'm type A, right? So I've had this planned out for like 2 months. So he's going to wear these very specific Halloween jammies, and then he's going to have his dinosaur costume with the hat, the warmth, everything. He's going to roar. We're actually going to our local library on Friday, where they're doing this, like you can decorate your own trick-or-treat bag. So he's going to make his own bag. So we're all going to dress up. We're going to go to that. And then we have a tradition with our neighbors that we've had since before their little one was even born. And we all dress up similarly. So like we're in the same sort of family. And then we walk around our neighborhood and we trick-or-treat. And then we all end up at our house and finish the night out and hand out candy. So
how nice is that?
Super looking forward to it. I know. It's like so cute.
That's
it's so fresh.
I can't wait to see a photo. That'll be fantastic. All right. Well, it sounds like a great plan. So we are here, obviously, to talk about today's episode of Device Talks Weekly. You are sitting in the big chair. We'll talk a little bit more about your guest after the Newsmakers, but tell folks who you'll be talking to.
Oh, absolutely. So I'm really excited that I'm going to be speaking with GE HealthCare's Scott Miller, and we're going to be talking about GE HealthCare's newest product called Genesis. And we're going to talk about how that is connecting all the different products and hopefully helping to lead to more improved efficiencies. So one of the challenges that Scott shares with me is that most of the data that's coming in is underutilized, dirty, can't do anything with it. 97% of it actually is never used. I didn't realize it was that high. I don't know
That's
if you
amazing.
did. Right?
Yeah.
97%. So one of the sort of effects of that is, of course, you have the inefficiencies, but then you have physician burnout, you have data overload. So the GE HealthCare's Genesis, this cloud-native enterprise imaging platform, is helping to bring that unused data to the forefront, clean it up, have it speak to absolutely everything in hopes to improve that kind of accessibility and efficiency. I learned a lot. I don't know a lot about technology, especially like on that level. We've said before, Tom, that we're dumb. I'm a dum-dum. So Scott really taught me a lot. And there were a couple of times I'm like, wait a minute, what is the cloud? Is it the rain cloud? And he was like, well, not quite. But he was very, very nice. And I know that our audience is going to learn a lot.
Yeah, and I remember, and I won't give the number, but of all the data created in the world, a remarkably large number of it is healthcare related. So folks can listen for that little doodad in the interview. So fantastic, and folks can also visit with you next week, right? On Device Talks Tuesdays.
Yes. I love doing the Device Talks Tuesdays. So thank you for every opportunity that you give me to do it. And I get to sit down with one of our favorite companies, Confluent Medical Technologies.
Absolutely.
We're going to be talking about what's next in balloon catheter technology. So if you haven't already, to our audience, please make sure to register for that. It's going to be at 4 p.m. Eastern Standard Time, 1 p.m. Pacific Standard Time. And we get to chat through Beyond the Balloon.
You can go to DeviceTalks.com to register, watch live, and get your questions answered right away. But if you can't make it at that time, same time, just different time zones, you can watch when it's convenient for you and ask questions, and Confluent will answer them anyway. So it's a win-win-win. And you get to talk to Kayleen Brown. How cool is that?
Oh, I do like that part. So please come and talk to me.
All right, let's get this podcast started. All right, you ready for this?
Ready.
Chris Newmarker, how are you, sir?
Hey, I'm doing well, Tom. Doing well. Happy fall. I mean,
happy fall.
Happy fall, yeah.
We're recording this on Wednesday. Friday is Halloween.
Yes.
I assume you'll be going out with the little ones?
Yes, and things are the little ones.
Where are we trending with costumes? Do you know? Have they been revealed yet?
It's going on the spooky side. I mean, we've they're all into Harry Potter, so they all wanted to be Dementors this year. So they basically, one of them's Harry Potter now, and two of them are basically wearing Grim Reaper costumes. We even got a Scythe. It's very, very spooky. Very
dark. The dark side of the Newmarker clan came out.
Exactly,
all right.
Yeah. So
no Hermione. No. Going right for the Dementor.
Wait, I asked my daughter, like, do you want to be Hermione? And she's like, no, I want to be a Dementor. You know, it's like, okay. I'm like, all right. So hopefully they can, instead of sucking people's souls out, they can scare some more candy from the neighbors. It'll be great.
Very cool. And this is our last podcast for October. I realized we hadn't really reviewed our pumpkin policy here on Device Talks Weekly, so let's review it again. Pumpkin flavored coffee. Chris Newmarker, yes or no? I'm a no.
I mean, it's nice to get it once or twice a fall. I mean, Xfinity just got rid of our internet for a day for some kind of whatever they were doing, and so my wife and I ended up over at Starbucks working, and I was
so
like,
you got your fix,
get a pumpkin spice latte, like a PSL. Here we go. So.
All right. So I think pumpkin bread. We're both on board with pumpkin bread.
Oh yeah, I already made pumpkin bread. Don't need chocolate chips. Just go for the straight pumpkin.
Absolutely.
Maybe a little cinnamon nutmeg in it, but you don't have to go. Yeah, just enjoy the pumpkin flavor, people.
I brought this up in a webinar yesterday, this very question. Someone raised the pumpkin bisque option. I think that's a pumpkin soup, pumpkin bisque. I think those are tasty.
It's nice. Get a little ham in it. Maybe get Caribbean in the spices, spice it up. I mean, that's fun.
Pumpkin beer?
Yeah.
No, absolutely not.
That's too much.
Pumpkin sausage, of course. I think we're pretty firm on this.
Pumpkin sausage. Blah. That sounds.
All right, so we know we have Chris Landon of Natus on our team, on our No Pumpkin Sausage team. Other folks,
good,
choose
Chris.
your sides, but choose them carefully.
Stick with it, Chris. Don't you? If they're trying to do some pumpkin sausage thing at fresh time, don't do it, man. Don't do it.
All right, so we've covered that. That again, once a year we need to restate for our listeners.
We got a lot of cream cheese at Costco, so we might do pumpkin bars. All
right. So is that like a pumpkin bread with cream cheese? You mean?
Kind of like that, yeah.
Well, that falls
it's
under
be
pumpkin bread.
A little more custardy.
I mean, then we can get it to scones and muffins and things like that. So I think things that are baked with pumpkin flavor in them are acceptable.
That's acceptable, totally.
All right.
We got that cleared out of the way. That's good. We got that off the table.
Next item on the agenda is the Newmarker's Newsmakers, Chris.
The Newmarker's Newsmakers. And man, the news just keeps on rolling out. I mean, number 5 on the list, we've got Zimmer Biomet winning an FDA breakthrough nod for what they're describing as the first iodine-treated hip replacement system. This article is from senior editor Sean Hooley, and we recently wrote about how they received a regulatory approval in Japan for the system, but Japan was where this system was initially developed. But ZB CEO, Ivan Tornos has described this technology as transformational. They've even cited statistics that the mortality rates around hip hip implant infections can be the same as breast cancer. So having a hip implant system that has this extra treatment that can prevent infections, they're really saying this could be a game changer.
Yeah, I mean, in terms of appeal to patients, if I'm getting ever need one and I'm given the option or it's mentioned as a possibility, I don't see why I wouldn't go with an iodine-coated implant. It seems to make a lot of sense. So
It's a tried and true disinfectant. I mean, they've been treating cuts with iodine since we were little kids. So
yep, I feel like this has been the year of Ivan Tornos, not starting with DeviceTalks Boston, but that's
I think it did. It started. He just kicked. It just took off. I mean,
but
that Arnold announcement.
Schwarzenegger and AdvaMed, and now this Zimmer Biomet having a great year. All right, what's number 4, Chris Newmarker?
That's right. Number 4 on the list, we've got Tandem Diabetes Care. They've announced that they're launching a T-Slim X2 insulin pump that pairs with Abbott's FreeStyle Libre plus CGM. So this is Tandem had teased this launch on social media early this month because the companies had first agreed to integrate in June, but it's just kind of the latest integration between these companies. I mean, Tandem is the major player in the insulin pump space, and Abbott is one of the top. I mean, really, in a lot of ways right now. Dexcom is really huge in the space as well, but Abbott CGMs, with the FreeStyle Libre, have just been really successful. So this is exciting news. And if you want to really delve into what's going on in the CGM space, we are doing finishing touches today on launching an extremely extensive report on the CGM market. This is a new product that we're calling our MedTech Market Intelligence Reports. We've brought on a team of veteran analysts and editors who have done these types of reports for decades, and they are really producing these reports for us that we're going to be selling off of MassDevice. So look out for those launching in the coming days. And these are much more, just go way beyond the type of things we've been offering on MassDevice in the past. So I'm really excited.
That's great. Data is power, so it's great to be able to provide this to the MedTech community. And I think next week, hopefully, we'll have Crystal Larson, one of the authors of the report, on the podcast to talk a little bit about her findings.
Crystal authored the CGM report. So looking forward to having her on next week to discuss it more, and we can kind of give people a few insights from it. We can't give it away. We're selling this thing, but definitely give people.
There's a ton in there that folks will be able to find.
There is a ton in there,
but
so
we'll leave some breadcrumbs for sure.
And then we'll be, after that CGM report, we'll be having, surgical robotics and then transcatheter heart valve reports coming out in coming weeks after that. So
exciting!
So a lot of exciting stuff. So,
all right, what is number 3, Chris Newmarker?
Hey, number 3 on the list, we've got Incisionless surgical robotic tech startup Petal Surgical. They're emerged from stealth, $10 million Series A, and the technology. This is a histotripsy. This is using focused ultrasound. There's actually a company here in Minneapolis, Histosonics, which is at this point raised billions of dollars. That is moving forward with this type of technology as well. But you just recently talked to the CEO over at Petal.
I did, and I wrote an article for Medical Design and Outsourcing that should be out. We're recording this on Wednesday. The article should come out today or tomorrow. I spoke with Prash Chopra, who's the founding CEO of Petal Surgical, and if you go on Petal Surgical's website, you'll see it has a high-powered team of co-founders and advisors, including Fred Moll, of course, the father of surgical robotics, and Ronnie Abovitz, who had been a founder or founded Mako Surgical. So lots of folks who have transformed healthcare already are teaming up on sort of taking histotripsy to the next step. And you can read Prash's inspiration. I mean, to give a little bit of a spoiler, his father died of sepsis after surgery. And Prash had already been in the medtech industry, but decided to steer his career toward ensuring that doesn't have to happen again. So they're looking at complete incisionless surgery.
Wow.
Keeping details to themselves, but the little hints that he provided are really exciting and makes you hopeful. So folks should check that article out.
I remember a conference like over a decade ago where like somebody who worked a lot with DARPA was like talking about like incisionless ultrasound-based surgery as some like really cool thing that could come out in the future. And now it's exciting to see this like becoming closer to reality. So that's fantastic.
Absolutely. So great news from Petal Surgical. What's number 2, Chris Newmarker?
Number 2 on the list, we got a big IPO, Tom. Really, really big IPO. We've been reporting that it was coming, but now it is here. I mean, Medline, the third largest medtech company in the world, according to our MedTech Big 100 list, has filed papers with the SEC to do for a proposed initial public offering. So off we go.
Yeah, this would not be the kind of IPO that would necessarily open doors for startups, but hey, it's good for the company to go out there, I guess. It's tough to be a publicly traded company these days, but Medline's got a lot of power behind it. So best of luck with that, Medline.
Yeah, it's interesting too. I mean, because they had a big private equity investment. We've been like writing about that trend of like more and more private equity investments among medtech OEMs. I mean, Hologic even now is in the process of getting acquired by private equity. But this actually looks like this could be a good exit for some of those private equity investors that
absolutely that makes
go on the IPO route. So yeah,
I see a young cub reporter, Chris Newmarker, wrote about this private equity investment back in 2021.
Yeah,
Blackstone, Carlyle, and
that guy could go somewhere. He had some promise. Yeah.
So 4.5 years after the private equity investment, they're going public. So if they're able to secure it, then they'll get that revenue. They'll get that potential return within 5 years, which is definitely what you're going for with a private equity investment. So
there we go.
Makes perfect sense. All right, Chris Newmarker, what's the big number 1 on this week's Newmarker's Newsmakers?
So number 1 on the list, this is from yours truly, but I actually caught the Commonwealth of Massachusetts announcing $17 million in tax incentives for 25 life science companies. I actually got like cued in that this was happening on LinkedIn because Brian Johnson, co-founder. Or the Godfather. I saw him posting
Godfather
about
of DeviceTalks. Yes,
I was like, I gotta write about this, and I looked into it, and actually the biggest chunk is going to Medtronic, nearly $5 million for a expansion in boy, I hope I pronounce this right, Billerica.
Nope.
No.
Try again. What? No, I won't even make you do that. Billerica.
Billerica. Wow. I thought Minnesota had some bad pronouncement.
No, we like to mangle things up here as well.
That's
Billerica.
Fantastic. Billerica. So good for Billerica. They're getting 220 jobs promised and there by Medtronic, in return for this nearly $5 million in tax incentives. And so far I've reached out to Medtronic Media Relations and just not getting more information at this point about what's going on, with that expansion. But definitely, I mean, gosh, that's good news for Massachusetts.
And I see Transmedics is on there as well. I believe they've got a new corporate headquarters that they're opening up in Somerville, which is next to Cambridge. It's going to be kind of maybe it'll be a building that with a logo on it that I can take you to on our next MedTech Nerd Tour.
Sounds good. We could do that nerd tour. Stop by there. I see Insulet over in Acton. They're getting $738,000 with a 41 job commitment. So it's fantastic.
Hope to have some exciting Insulet news in a couple of weeks, so folks can stay tuned on that.
Very cool.
All right. Well, it's nice that we're giving the medtech industry its due here in Massachusetts, and certainly we'd love to see it continue to build. I'm looking at the list now. I see Cerevasc. Of course, we've had them on the podcast, and lots of great names. Instilla, which is led by Amar Sani, who's a great medtech innovator. So lots of good folks getting some support from the Commonwealth of Massachusetts. So take that, cool. Minnesota.
Yeah, there you go. Right, we had some nice debates going on about that. But no, it was nice. Yeah, it's good
It's
to
fun.
Massachusetts
It's
people
fun.
gotta take a victory lap around over that one. I mean, this is good. Like
It's
so,
good, clean fun.
it's
So
good.
we're all med tech. We're all family. We're just like brothers. We just
A
like to,
rising
poke
tide
each
lifts
other
all
from time to
boats. I mean,
time.
this is good. I mean, it's good to see like the Massachusetts life science hub is vibrant and well, and it's exciting to see Medtronic expanding there. So
Excellent.
very cool.
All right, Chris Newmarker. Well, don't eat too much Halloween candy. Don't mess with the Dementors. You don't want them haunting
You don't
your
want to mess.
dreams.
I'll have to work on my Patronus charm, I mean, in no way am I reading all those books to my kids. I mean, no, yeah, I'm totally reading all those. So, yeah.
I did
I
the
did find
audiobooks.
out.
We
I
the
did have
audio-
my oldest son showed me the other day that you can use the wand lighting spell from Harry Potter to make your iPhone light go on. You can say like Lumos, and it'll turn on. Siri will turn on your phone. Light.
No way.
Yeah.
I'm going to try that right now. Hey, Siri, Lumos. Ah, it worked.
That's
Look at
fantastic, isn't it?
that. Wow.
Magic is real.
I'm a wizard. Look at me.
I'm a wizard.
I'm going to do that
wizard.
at least 3 or 4 times this afternoon. Thanks for that, Chris Newmarker.
Glad I could spread a little joy there, man. So, all right, cool.
Take care, buddy. All right, well, thank you, Chris Newmarker, for this week's Newsmakers. Kayleen Brown, once again, let's introduce your sit-down with...
Scott Miller, CEO of Solutions for Enterprise Imaging at GE HealthCare. I hope you all enjoy. Scott Miller, welcome to the podcast.
Thank you, Kayleen. Thank you for having me.
Scott, I'm really looking forward to chatting with you about enterprise imaging solutions. And before we really dig into GE HealthCare's enterprise imaging solutions, I want to know more about you. So how did you get into medtech? Why this industry laid on us?
Yeah, well, believe it or not, this is my 28th year at GE HealthCare. So I'm a longtime veteran at GE HealthCare. It's nearly all of it in our imaging businesses. And I started as a mechanical engineer. So I went to school for mechanical engineering. I was always interested in how things worked, how things could be put together, process end to end. And I really found myself attracted to GE as a management company, and then GE Healthcare as an innovative company within GE. So GE Healthcare has a wonderful commercial leadership program. So I actually came in through that leadership program directly out of college. And one of the main reasons was the ability to have a very large influence over a broad range of products and direct customer interaction directly out of college. So it was like being the CEO of a $10 million business as a, say, 23-year-old direct out of college, but in the hospital space. So I got to go to hospitals, every day, spend time with customers directly and help them solve problems. So it was really the culmination of that. And 28 years later, I'm still here at GE Healthcare.
Well, I have to say, I really respect your singular vision, that you knew what you wanted to do and you found the right pathway that was right for you. And clearly, 28 years later, you must find success personally and professionally. And I'm happy to hear that about GE Healthcare. So then maybe, Scott, you can help us better understand really what is enterprise imaging solutions. Like for the layperson like myself, like what does that really mean and why is that so important for health systems?
Yeah, so I think maybe the easiest way to think about it is to think of it from a patient's perspective. If you're a patient, you might unfortunately like have a fall and have a fracture, or maybe have a headache and need a CT scan, or need an MRI scan. So after you get that scan goes to a computer system, and that computer system displays the image and allows a radiologist to diagnose the scan. So enterprise imaging is really that picture archiving and communication system that takes the device information, displays it for a physician to look at, and then enables them to interpret it to give you a diagnosis so that you can take the next form of treatment.
Oh, okay. So it's in a way a central repository for this imaging so that all the different clinical areas maybe can refer to it, use it as the source for the decision making that happens after?
Yes, yes. So with our solution, it turns the information from the device into something that's actionable for a physician to interpret. And so to take it even further, think of it as in kind of the older days, somebody would produce a film. So you would actually produce a film and it would be on a light box. But because of that, it was just one discrete item. Think of it like a photo. Think of an old picture where you would take like a Polaroid and you could get one picture. But if you wanted to share that with somebody else, you could take it to them or mail it to them. But this is a digital version of that, which allows that picture to be digitally viewed anywhere in the world. We'll get into maybe a little bit of that. It could be anywhere in the world, could be anywhere in the health system. That image now can be moved around to other clinicians. So think of it like going from an analog picture to a digital picture that then can have intelligence around it, like what pictures happened before, what treatment might happen afterwards, and what happens with that report. So they used to handwrite it, then it went into a dictation system. Now all that information is available anywhere to be accessed by anybody securely.
Oh, first, thank you. That really helped clarify it for me. And I mean, I think we throw a lot of terminology around, a lot of different terms in the industry. And sometimes it's just, we need a minute to say, okay, like what actually is it? And then from there, we can really understand how important it is. And I'm already pulling some threads. I could see how immediately just digitizing,
Yes.
that is a game changer. So I'm excited to see, the other elements that have improved the innovation. But let's talk about the challenges right now, like in today's world. And if you're focusing on the clinical areas that depend on imaging, so radiology, oncology, cardiology, I think you mentioned a couple of those.
Yes.
What kind of challenges are we facing in enterprise imaging? What challenges are we facing currently that enterprise imaging could be helping to solve?
Sure. So as I mentioned, the data that used to be analog is digital, and those are just pictures. But there's a lot of structured and unstructured data as well. You might be surprised to know 1/3 of the world's data is generated by the healthcare sector. 1/3 of all of
Wow.
the data in the world is in healthcare. Unfortunately, 97% of that data is never used. So generate a lot of information and we don't use it well. I'd say the second big challenge is physician burnout. So with this high volume of data and more patients that need either imaging or tests, um, doctors are reporting burnout. 63% of US doctors report feeling burnout, and nearly 50% of radiologists are affected. So the radiologists are the ones that read these images, and they're just getting bombarded with more and more data that's not in a usable format and is not very easy for them to do their job. So a lot of data, a lot of unused data, and then significant burnout in the industry.
What about new talent coming into industry? Are you finding that there are enough radiologists to support the need?
There's absolutely a shortage of radiologists. Uh, During COVID, there was a higher percent of radiologists that retired. So we had a higher percent of physicians leaving the workforce. So there's more work to be done and fewer people to do the work.
Wow. I mean, these are pretty significant challenges. So maybe we can talk through one potential solution. So I know in July, GE Healthcare launched Genesis,
Yes.
a next generation cloud native enterprise imaging platform. So can you talk us through first, what is that and what makes Genesis a milestone for the field?
Sure. Maybe take a step back. Why even talk about the cloud to begin with? Um,
Yes, please.
so the cloud to me is an enabler for efficiency and scale. So what do I mean by that? Let's use a different analogy. Netflix. Netflix started in vending machines And you could get a movie, but you had to actually go to a physical site to get your movie, and then you could mail it back. It was an innovation that you could go pick a movie that you wanted. You didn't go to Blockbuster anymore, you went to Netflix. But now Netflix, by being on the cloud, enables you to watch any show in any location, on your phone, on an iPad, on a TV, in your hotel room, on the airplane. So that cloud deployment scales these manual CDs to be information or entertainment anywhere at any time. So that same type of capability is enabled by the cloud for enterprise imaging. I mentioned to you the old way was you printed a film and you mailed it around. The next thing was you could digitize it, but it sat in a disparate location. And as long as you were in that location, you could access it. Now, by being on the cloud, all of that data is now accessible by anybody as long as they have a secure access to it anywhere in the world. So what this enables is, from a clinician standpoint, I can read images from an island. I can read images from the beach. I can read images from my home. I can read images from anywhere. I can report and dictate that anywhere. And also I can scale my solutions. So for instance, if I'm a health system and I acquire another health system, instead of trying then have two different systems, I could connect that and integrate those systems. So for a clinician, I have access anywhere. I think I can watch my movies anywhere. I can do my work anywhere. If I have a new family member that's in another location, just like I acquire a new location, that new family member also has access to all of that. So it's really scales the ability for health systems to expand, and also for physicians to do their best work from anywhere and reduce that cognitive burden. So for Genesis, for us, the Genesis, we put Genesis Store and Genesis VNA, which is a vendor neutral archive. Think of it as the simplest way to think of it as storage that's intelligent storage. So that if Kayleen came in with a procedure that you would have to have done, your prior procedures could all be accessed from the cloud, so that all of your patient history would be in one place, so that when that clinician sees your current study, they have all of the context of your prior studies, so that they know, okay, this has progressed, something has changed, and don't just look at your information in isolation. So for us, Genesis is a real breakthrough because we can now offer storage on the cloud and this vendor neutral archive on the cloud to enable our customers to be much more efficient and much more cost effective.
So it was helpful to think about digitization being a leap, then cloud-based technology being the next leap. I know that we'll talk about artificial intelligence because I suspect that might be maybe the third leap. But before leaving Genesis, you said a phrase that caught my attention. You said vendor neutral. Can you expand on that?
Yes. So vendor neutral archive means we are vendor agnostic in the ingestion of data. So GE HealthCare is a very large company, a big organization, but we're not the only organization in healthcare that produces healthcare data, that produces imaging devices, produces cardiology data. So vendor neutral archive means we're vendor agnostic. We use DICOM standards and HL7 standards so that we can enable customers to access and make sense of any vendor's data, so that we can get a 360-degree view of a patient, no matter where the data has come from.
Okay, that's helpful. Can you help me understand how that's different from interoperability?
So they're related. I'd say a vendor neutral archive is an enabler of interoperability, where then you can bring data from different locations and aggregate that data in an intelligent way. So the vendor neutral archive is an enabler for that. If it was not a vendor neutral archive, you would not have the interoperability, because that would be siloed data that wouldn't be connected to the rest of the data.
Oh, you are just connecting bridges to all of these thoughts for me. So thank you. And then again, thank you for allowing me to kind of work this out in my head here. Uh, Thinking about Genesis again, what kind of impact have you been seeing from the early adoption of Genesis, either from clinical workflows, efficiency, collaboration? I know that you touched on it, but do you have a sense of the impact so far?
Yeah. So we launched Genesis at HIMSS in March. So we're still, ramping up customer adoption at this point. The early adopters are saying we now have the ability to leverage Amazon Web Services and our Amazon Cloud connected with this scalable solution to be more cost effective and to enable efficiency for our clinicians.
Okay, well, I guess there's a couple of questions here. So
Sure.
adoption period can be a challenge. Are you finding that the adoption with your customers and clinicians, it's going well or it's going as expected?
Absolutely.
Or are you finding challenges with, oh, good.
No, it's absolutely going as very well. And so what we're finding is customers are looking for, many customers started with their data in on-premise storage facilities. So they have servers that they've already invested in. And so really we're enabling our customers to migrate that data to the cloud. Think of it like you have pictures on your iPhone. You want them in iCloud so that then you can have more storage, the ability to distribute it, a much longer range archive. So that's the first step for many customers. The first step for most customers to the cloud is they want a cyber secure system. So they want cybersecurity because there's a lot of, it's difficult to maintain an on-prem. On-prem just means in their facility versus a managed external storage system. So typically the journey is I move my data from my current location to the cloud. I cleanse that data so I have more use of that. And you might say, what do you mean by that? The cleansed data means when all of this data is acquired, you might say Kayleen Space Brown. You might mistake by putting Kayleen Space Brown. Somebody may misspell your name. Somebody may put K Brown. So it's making sure that all of that data that's in the cloud is usable so that all of your prior data is together. So the Genesis opportunity is, one, I get all of my data to the cloud. Two, I have an increased cybersecurity. And three, that data is very usable and easily retrievable so that I can then make good decisions about Kayleen.
Oh, that's fantastic. I think that your example of how maybe the human element inputting the information with an extra space or some of the other examples that you use, that makes a lot of sense because that changes what the data is. And if you have Genesis that's able to look at that and almost like contextually pull that data together so it builds a patient profile, I mean, that really is a game changer.
Yes. See, you are an
Any
expert.
other
Expert in enterprise imaging. You're calling yourself.
Do you see the hamster wheel in my brain? It's working really hard right now, like generating, trying to piece this together.
But that's exactly it.
Talk to me about the human heart.
Yes, but that's exactly it. All of this unused data, as I mentioned, Genesis allows that data to be cleansed and utilized and then made available everywhere. So then they can take the next leap, which I'm sure we'll talk about a few other leaps. But this is just the beginning. Now that I have all this wonderful data in a usable format available to everybody, what might I do with it? That's really the next exciting part of this story.
That's exactly where I think that we should go with it. So I think anybody who's listening and has pulled out their bingo card, they're going to know that I'm going to talk about artificial intelligence next. I love AI. And some of the common themes in my conversations when it does come to how AI is being integrated in medtech is this: if you don't have good data in, you're not going to have good data out. So you're solving 50% of that equation here. So all of that said, let's really dig into artificial intelligence and how GE Healthcare really has embraced it. So one, talk to me about how important is AI in GE Healthcare's strategy. So let's start there.
Yeah, I would say AI is critical to our strategy. I mean, we are transforming to be a cloud-first, AI-powered, software-enabled business. And we're finding AI applications really that are really relevant in all areas of healthcare. So the way we look at it, we employ a strategy called D3, devices, disease states, and digital. And so when we think about AI, AI works on devices. So think of it on an MRI or a CT scanner. It also works throughout a disease state. So I just talked about radiology or cardiology and these workflows. And there's an overall digital layer, which then I talked about being on the cloud. So if I can unpack AI a little bit more, on the device side, we now have 100 FDA AI-enabled medical device authorizations, number one in the industry. So it is not only a part of our strategy, it's in clinical practice. We have millions of patients who have been imaged or have had AI-enhanced exams. So we are a leader, and some would say the leader in the med device space in AI. And what we're finding is AI delivers clinical benefits on a device and also operational or workflow benefits. So think of an example like Air Recon DL and MRI, where the exam is faster and the image is sharper. So it helps the health systems, it helps the patient. And with the sharper images, it's easier for a clinician to make a diagnosis. So that would be on the device side. We have over 100 AI authorizations. On the enterprise imaging side,
Congrats.
thank you very much. Thank you. Yeah, we're very proud of this, not for our sake, but for the impact it's made on patients and caregivers alike. So really dramatic change on the device side. Now through the disease state, what we're hearing and what we're finding is that customers are actually frustrated with AI in the enterprise imaging space. So let me explain what we're seeing. We're seeing that because of the burnout for radiologists, the last thing they want is to have to click another button, go to another workflow, or go outside of their current, user experience. So even if that might promise some value, the cost of a new workflow, more time, untested results is really frustrating. So what we're starting to see in the industry, there's some backlash to AI. We're seeing some health systems think AI is just this magic answer. Hey, give me more AI. That is not our perspective at all. In enterprise imaging, we are integrating AI into their workflow to improve efficiency, to reduce burnout, to reduce clicks that are unnecessary, and to help enable radiologists and cardiologists and all clinicians to operate at the top of their license. So that's really the difference, not AI for AI's sake, but AI embedded in the workflow, especially to eliminate the mundane tasks that honestly, most physicians never went to medical school to fill out paperwork or to complete checklists. They love whenever they can focus on the patient, they can focus on the image, and they can focus on the diagnosis. And that's what we're leveraging AI for in their workflows.
And I think, please correct me, but you were talking about the 3D. So you mentioned devices, disease state. What was the third one again? Can you remind me?
So it's really that the digital layer connects through the enterprise layer. So the individual devices can produce information. And then what I talked about with Genesis, the vendor neutral archive, the ability to orchestrate all of that information in a digital layer within the physician's workflow to be able to get an answer.
As you're unpacking this with me, I can't help but get the image of you spinning plates in my out of my head. Like, there's just so much to consider. Here you are, just like trying to make this work on an enterprise level for not just your customers, but for clinicians and ultimately for patient outcomes. I mean, that's a lot to balance at one time. Can you give us? I'm trying to think of a good example of how I'm stuttering my way here because I really like how you phrased you being GE Healthcare, don't use artificial intelligence for artificial intelligence sake. You use it for very clear goals and for very clear outcomes. And you'd given a couple of examples of like removing a step in a clinician workflow so that they have more time, presumably, to actually do what they went to medical school for, as opposed to, filling out notes and checking boxes and checklists, to your point. And I think that's really important. So have you seen, since GE Healthcare really went all in on an artificial intelligence, have you seen these workflow efficiencies really be optimized the way that you were expecting them to be? Are you seeing anecdotal or actual in numbers stating saved time, better outcomes? Like, walk us through that.
Yes. So one specific area within enterprise imaging is the use of a work list. So think of it like your email. You log into your email and you have a whole set of emails. They can either be prioritized for you or they can just be first in, first out. When you have large radiology groups, typically you have specialized individuals. They may be neuro, they may be body, they may be musculoskeletal, they may be MRI only, they may be breast imagers. And so what we've been able to do is to have an intelligent work list powered by pace and balance to enable clinicians to get the right next exam for their specialty and for their level of acuity. So you might have a junior general radiologist take the easy things, and you might have a subspecialized neuroradiologist take the very difficult neuro MRI, and it's all configurable by the health system. So we've seen productivity of 20 to 30% improvement in overall reading efficiencies just by leveraging an intelligent AI-enabled work list. And that's just one example. We've got many features and additional enhancements that are coming. We'll be launching some new solutions at the Radiological Society of North America around Thanksgiving. So I'm not at liberty to discuss some of the next generation of benefits. I know, Kayleen, you tried to get it out of me, but I can say just a prioritized work list is dramatically changing the reading experience for a radiologist.
Well, I love that. And I can't wait to hear the announcement. It's a lot to look forward to at the end of November. So please let me know. Continuing on the theme of opportunities. So we know AI brought a lot of opportunities. We know the cloud brought up a lot of opportunities. What about remote access? I have to imagine that that's one of the biggest areas for opportunities, like remote scanning,
Yes.
remote reading. Talk us through like why that is important and why it's a critical part of your roadmap.
Absolutely. So I'll go back to the challenges, which then present opportunities. So we have there's staffing shortages for both radiologists, like we talked about, but also technologists, the individuals that actually complete the exam. So an enabler is cloud. So just like you can watch Netflix anywhere, by being able to read images anywhere, it enables a balanced workforce and the ability to get the best talent from anywhere. So rather than maybe you're in an area where maybe housing prices are expensive, or a place that maybe is a rural area where somebody, for whatever reason, may not want to live in that area or they already live somewhere else, it opens up access to the right clinicians. So one, cloud enables that. And so remote reading enables that workload to be distributed to a scarce workforce. On the scanning side, we see the same thing. So you may not have enough technologists to run, say, your MRI machine. Your demand is higher than your supply, that you can do that. And also some of the exams become very complex. So you might have one really skilled MRI technologist, but they may live downtown in a certain city, but patients don't want to go downtown. They want to go to the closest location with convenient parking and other amenities like that. So now we're enabling that skilled technologist to remotely log in wherever the patient wants to be imaged and get a high quality study without commute time, without any inefficiencies. So the systems are more efficient in scanning and the physicians are more efficient in reading. And honestly, it makes for a happier workforce, especially in a very competitive market.
Everything that you're telling me, Scott, really makes me feel so hopeful about the future and how GE HealthCare is really looking at patients, your customers, clinicians, and trying to mitigate these challenges as much as possible so that we can provide, as an industry, better outcomes for all of those stakeholders.
Absolutely. I would say we're expanding access to healthcare, and that's really, we're making it easier for patients, making it easier for clinicians. And we also like to say we're democratizing healthcare, where more people can have access to high quality care at lower cost.
I love that term, democratization and democratizing. I think that is the key. And that's maybe why I'm such an enthusiast when it comes to artificial intelligence, because it's democratizing so much. It's democratizing innovation. And to your point, helping democratize healthcare and health access or access to healthcare. And that's so beyond important. Before we shift to the future, Scott, looking at the challenges that you outlined and maybe the opportunities that have come out of those challenges, have we missed anything? Or do you feel as though we've covered sort of the challenge opportunity landscape?
So I think we talked about the challenges and opportunities. Certainly staff shortages, more procedures being done, more testing, fewer people to do it, needing access. I would say, maybe to summarize some of this, I'd say the cloud is an enabler, but it's not the answer. The cloud allows clinicians to be more efficient and health systems to be more scalable. There's an additional piece, which is called software as a service, or SaaS for imaging. The reason I bring this one up, which we haven't brought up yet, is it changes the business model for a healthcare system. So the traditional way for a health system to acquire technology is buy something, keep it as long as possible, and buy a service contract with it. The tough part is the pace of innovation today is so much faster. I mean, think if your iPhone never got an iOS update. I mean, you get iOS updates all the time.
Yeah.
But if you didn't have that, you'd be on some old version of an iPhone, which probably wouldn't work very well. So this software as a service enables health systems to subscribe to the technology. So now the pace of innovation can be brought to the healthcare system in this subscription that's orchestrated over the cloud. The cloud enables providers like us to create solutions more quickly and deploy them more quickly. So think of the cloud as, think if Netflix had to still send you CDs. You probably wouldn't be able to watch all of the movies you want to watch. But Netflix can upload those every day if they want to. Same thing with healthcare providers. So the cloud deployment enables us to innovate more quickly, deploy more quickly. And then this SaaS model allows you to not have to go to another budget cycle, go ask for more money. You just get it. So you get all of the innovations, and the cloud enables me to get them directly to you immediately. So the whole business model is changing.
You ask me, what is the anatomy of a heart? I can tell you that. You ask me about enterprise solutions and artificial intelligence and software as a service, and I'm lost. So thank you so much for taking the time to put that in just like a neat package. My type A brain is like, yes, I get it. I see the need. I see just the opportunity that's coming out of it, and it's made me even more excited to learn more. Let's just maybe circle around to the future and bring that hope to the, let's say, next 5 to 10 years. So what is your vision, your personal vision of the future of enterprise imaging, and how do you think that GE HealthCare may help drive that?
Yeah, so I think the future of enterprise imaging is a path to smarter, more connected care. So we've talked mostly about radiology, but enterprise imaging is well beyond radiology. It's bringing radiology, cardiology, digital pathology, wound care data. So think of the future of enterprise care as bringing all of the multimodal data together into a 360-degree view of every patient to deliver personalized precision care. So understanding the totality of the patient. So imagine a world where your wearable information, your blood pressure, there's a lot more information that we haven't yet talked about that I would envision will be fully integrated into your overall electronic health record, such that you can be treated as an individual, and every healthcare clinician can leverage AI, generative AI, agents to essentially have a multidisciplinary care team at everybody's fingertips for every patient to be treated personally. So really the future is personalized precision care by leveraging this large volume of data that today goes largely unused to really ensure that earlier and earlier that you can make the healthiest decisions to live a long, healthy life.
Isn't that the dream? I started in the industry 20 years ago, and to think that that's where we can be and can be in my own lifetime, I mean, that's everything, Scott. That is everything.
It's possible, Kayleen. It's happening. It's happening today in pockets. So this is not something that's so far away that it's impossible. It does take, healthcare systems to really take a leadership role in how they want to integrate and utilize their data. But this is really possible today.
Well, Scott Miller, CEO, Solutions for Enterprise Imaging at GE HealthCare, thank you so much for joining us on the podcast. And thank you for expanding my mind and giving me even more hope for this beautiful industry that we are so lucky to be a part of. Thanks for joining us.
Thank you, Kayleen. My pleasure.
Well, that is a wrap. Thanks so much for joining us on this episode of Device Talks Weekly. Once again, I hope you joined Kayleen Brown on Tuesdays, Device Talks Tuesdays, with our good friends from Confluent. Go to DeviceTalks.com to register for that episode. You can watch that live, can watch it on demand, get your questions answered either way. Please take just a minute to subscribe to the Device Talks Podcast Network so you don't miss any future episodes. We've got some great new podcast series that will be launching very soon. Don't want to miss those. And also make sure you connect with me on LinkedIn, connect with Kayleen Brown on LinkedIn, connect with Chris Newmarker on LinkedIn, and follow Device Talks if you would. We're over 10,000, woohoo, and we'd love to be even bigger than that. So make sure you follow us. We'll be sharing information about our podcasts, about our events, but also about MedTech at large. So we'd love to have you as part of our Device Talks community. Take care, everybody. Thanks for being part of Device Talks.